Good evening and welcome to the Freestyle webinar on Understanding Diabetes Burnout. We would like to thank you all for joining and hope you find all the information presented this evening useful and informative. If you're having any sound problems, you can disconnect and reconnect, and that should sort these out for you. Now on to today's webinar. The purpose of today's webinar is to provide you a practical guide to managing your diabetes and understanding the implications of diabetes burnout. During tonight's webinar, you'll hear from Dr. Jen Bateman, who's a clinical psychologist. She will be taking you through all the different aspects of diabetes burnout and how they've affected her life as well as others. At the end of today's webinar, we'll have time for questions for Jen. You can ask a question by typing it into the chat window down the right-hand side of your screen. We will attempt to answer as many questions as possible, but we'll leave these all to the Q&A session at the end so we don't interrupt the presentation. Please note that we're not able, unfortunately, to answer any individual or clinical questions this evening, but you should contact your healthcare team if you do have any specific clinical questions. Following the webinar, we'll email a questionnaire out to all of you to find out how you found today. Please do take the time to complete this, as it really does help us shape the education that we offer in the future. Well, hopefully by the end of today's session, you will have a clearer understanding of diabetes burnout and how it will better help you manage your diabetes. Now, let me hand over to Jen, who will introduce herself and go through tonight's presentation.
So yes, I am really pleased to be joining you this evening. A great many thanks to Abbott and the entire team for creating this space for us to be together this evening to think about this really important topic of diabetes burnout. So I'm Dr. Jen Bateman. I'm a clinical psychologist, but first and foremost, I'm someone living with type 1. I've been living with diabetes since childhood, and I'm really open about the fact that I've struggled a lot over the years to manage my diabetes. So of course, age 6, I really was reliant on my parents, particularly my mum, to guide and navigate me through those early years. And I'm really grateful for my mum for all her hard work doing that. And actually, for many years, I probably would have described myself as quite a good patient. I did what I was supposed to do, and kind of got on with life. But it was really in my adolescent years that I started to question my identity as someone living with diabetes. I really didn't like the fact that diabetes made me different, and I struggled to accept this aspect of myself. And so the outpouring of that was that I started to hide that I had diabetes. When I met new people, I wouldn't share that I was living with diabetes. I would hide my self-care tasks. So of course that meant either taking myself off somewhere privately to do what I needed to do to care for my health, or delaying doing it, or not doing those self-care tasks at all. So of course, that had a huge impact on my diabetes well-being. And I got to the age where I was really responsible for taking myself to my diabetes appointments. And I had a really excellent, skilled, kind team of health professionals supporting me in those years, and some of them I actually know now, all these years later, and they were really dedicated and they were really supportive to me. However, I really struggled back then to tell it like it was when it came to my diabetes. I'd been on the education courses. I was bright enough. I kind of knew what I should, in inverted commas, be doing when it came to caring for my health. But somehow, when I left that medical appointment, I just struggled to implement what I knew I should be doing to care for my health. And I didn't have the words or the language, really, to be open and honest about my struggles. And of course, back then, this is a number of years ago now, there wasn't really the same attention being paid to the impact of emotions on living with diabetes. So the health professionals involved in my care, as dedicated as they were, they didn't particularly ask me, about the emotional impact, because that wasn't really on their radar either. So I just stopped going, and I went for a number of years without attending any health appointments. But for all those years, it really was a guilty secret of mine. I knew that I was doing damage to my health, and I was scared. I was scared for my future, but I had a lot of issues. I had diabetes burnout, which we're going to focus on tonight. But I also had eating issues. I was fearful of having hypos, so I would run my blood glucose levels higher than I needed to. I had a fear of the future. I had a lot of distressing emotions when it came to my diabetes. But alongside all this, I was getting to the age where I needed to decide what on earth I was going to do with the rest of my life. And I was really interested in psychology. And to be perfectly honest, I was interested in psychology because I wanted to understand myself differently. I wanted to understand why on earth I couldn't just get on with it and do what I was supposed to be doing to care for my health. So my initial motivation for studying psychology was actually because I wanted to understand myself differently, and I wanted to get to know what were the blocks, what were the barriers, what was getting in the way of me being able to care for my health. So fast forward a number of decades, and I'm pleased to say that I've had a number of therapy experiences with a number of professionals that supported me through understanding myself better. And I trained to be a psychologist, and now I love nothing more than to support people both living with diabetes and health professionals supporting people living with diabetes to understand about the important role of emotions and how we can understand them and overcome them in order to better our health and well-being. So it's a real pleasure to be joining you here tonight. And yes, this is a serious topic, but I do like to inject a little bit of humour into my presentations. And this is one of my favourite jokes about psychologists. How many psychologists does it take to change a light bulb? Just the one, but the light bulb has to want to change. And like most humour, this does have a kernel of truth to it. You know, psychology, when as it is applied to diabetes, has a lot to offer, but it has to be in partnership with a willing participant, someone who is really interested in doing the often hard, uncomfortable work of that psychological inquiry in order to reap the benefits. So my hope is that there will be one or two of you here tonight who will be interested to take this on for yourself and to really reap those rewards of applying psychology to your challenges with diabetes. That said, I am a psychologist, but I'm not your psychologist. So really, this is an educational session, and my hope and my intention is to really point you in the direction of getting the very individual, very personal support that you need from a health professional who knows you and can advise you personally and individually. So with that in mind, what are we going to cover tonight? Well, my hope is to take you on a whistle-stop tour to look at what we mean by these terms diabetes, burnout and distress, and to help you to identify whether or not you are indeed experiencing diabetes distress, and to know how to get that support that you need for yourself in order to recover. And I'm going to be signposting you to resources to help you with that. And of course, we're going to have time for some Q&A. So, a day in the life of living with diabetes. Well, you and I know that on paper, you know, life with diabetes can look quite straightforward. I think oftentimes people around us look at what's required of living with diabetes and think it looks quite simple. You know, we just need to take some medication, eat healthy, move frequently, be careful of our lifestyle factors. But of course, you and I know, living with diabetes, that in reality, there are so many layers to the challenges of daily life with diabetes, and it absolutely takes its emotional toll. And this slide is really just a taste of some of the experiences that you're likely to have had a taste of in your daily life with diabetes. Worries, anxieties, dislike of hypos, needles, not wanting to draw attention to your diabetes, not wanting to tell people about diabetes, not wanting to take your medication or do your self-care tasks in front of other people, perhaps. Frustration and stress. You know, life is busy enough with, you know, work, college, studies, family, And then we've got the added burden of all the self-care demands that diabetes requires. And it's a real juggling act to be able to balance all of these competing demands. And we've got to create this relationship with a medical team who, at the end of the day, start off as strangers, and we have to often speak about the very personal details of our lives. So this is just a taste of some of the things that really we can struggle with when it comes to daily life with diabetes. So what do we mean when we talk about diabetes burnout and diabetes distress? Well, diabetes burnout is really a phenomenon that's been around and has been studied for many years, since the 1990s, when it was first identified by a colleague of ours in America, Bill Polonsky, a psychologist, who defined burnout as a state of physical or emotional exhaustion caused by the continuous distress of diabetes and efforts to self-manage it. So burnout is really a state of exhaustion. Diabetes distress is really trying to manage these demands before they reach that end point of diabetes burnout. So distress is kind of the everyday distress, the everyday burden that we all have to navigate and acknowledge and live with, that arises from living with and managing diabetes. So in an ideal world, we would all be, what we might call a confident self-manager, someone who's able to take diabetes in our stride. But if we struggle, then we tip into this experience of feeling distressed by our diabetes. And if we don't get support, or if we aren't able to access support for our diabetes distress, burnout is really that end point to that experience. So our goal really, and the health professionals on the line today, our goal is to be able to identify people who are tipping into this state of diabetes distress and feeling burdened by the condition before they reach this end point of diabetes burnout. We really want to be able to get the support that we need before we reach that end point. So you may well be familiar with the analogy that diabetes is like a job, and it's not like any old job. It's a job that we have to do 24/7, 365 days a year, forever, without any holidays or time off for good behaviour. We know that we would reach burnout state if we had to do a job or studies 24/7, 365 days a year. As human beings, we aren't human doings. We are human beings, and we need rest and we need time off in order to come back stronger to do that job or to do that studying. So it's no wonder that we struggle with feeling a sense of distress and burnout, because we don't have any time off from the constant demands of diabetes. And I often like to share another analogy, which is diabetes being a bit like a baby. And let's firstly pause to say a little R at the cute baby on the screen right there. But this is when we're diagnosed with diabetes, it's a bit like having to have a baby to look after, and it's a baby that was unexpected, was definitely not wanted. It was a baby that we didn't have 9 months to prepare for. It's a baby that we don't get a break from. It's difficult. It's a baby that's difficult to handle, and on top of all that, it's a baby that never gives us smiles or cuddles. So I'm not a parent, but those of you who are parents listening in, imagine if you had to do all this work of caring for your baby and it didn't give you that lovely reward of the smiles or the cuddles. You'd get burnt out as a parent. And it's exactly the same with diabetes. We have to work very hard at this condition, and so burnout is actually very, very natural. So I want to share with you some signs about whether or not, to help you identify whether or not you may be experiencing diabetes distress. And again, this isn't about me diagnosing you. Diagnosis can only really be done, or identification can only really be done with a health professional. But I want to share with you some clues that that if you're struggling yourself, you can be on the lookout for. And if you're a health professional, these are also clues. If you hear these kind of words come out of the mouths of people with diabetes that you're supporting, that's a little flag that perhaps this is someone that you're sitting with that is experiencing diabetes distress. So, and if you're reading these and thinking, yeah, I hear myself say these things in the quiet of my mind, then yeah, it's likely that you're somewhere on that continuum of diabetes distress. If you're often thinking things like, this is really hard, I feel like I'm failing, I can never get it right, I'm useless, what's the point, nothing I do makes any difference. These are really important thoughts to pay attention to. And then beyond, the thoughts or the things that we might say, what are the non-verbal kind of signs of diabetes distress? And again, for the health professionals listening in, these are things that you may well notice in the people that you're supporting. So if you're feeling distressed, it's likely that you're not going to really want to attend your health appointments regularly. It's likely that you're skipping your self-care tasks. You're likely to be paying less attention to your health in general. You might be taking risky behaviours with your health, just as I was doing. I was, skipping doing my self-care tasks, or I was delaying doing them. And because of that, you're likely to have a HbA1c that's higher than recommended. You're probably going to have more frequent extremes of blood glucose at both ends of the spectrum. And you're likely to have this kind of nagging sense of being overwhelmed and being defeated by diabetes. We all have bad days with diabetes, just like parents, or if you're studying or if you're working, everyone has bad days. That's part of being human. But diabetes distress is, we're more likely to have these on more days than not. This is, a regular occurrence, having these kind of feelings of being overwhelmed and defeated. And you may well be feeling angry, and rightly so. There's often some why me type thoughts, because it can feel very unfair. So again, if you've identified yourself in some of what you've heard, I want to reassure you, you're not alone. Lots of people struggle in these ways, and diabetes distress is actually pretty common. Almost 1 in 3 people living with type 1 struggle with diabetes distress, and almost 1 in 5 living with type 2. And I want to say a few words about the distinction between distress and depression, because diabetes distress is distinctly different from depression. Diabetes distress is actually quite a natural response to the demands of living with a long-term condition. And it's not a disorder, it's not a mental health disorder in the same way depression is. Diabetes distress is actually much more closely aligned to the feeling of grief, or the experience of grief, in that it's natural. If you lose someone that you love, it's natural, it's to be expected that you will grieve and you will feel sad and you will feel a loss. There's nothing clinically wrong with you, there's nothing abnormal about you. It's exactly the same with diabetes distress. It's a natural response to many of these demands. And the way that we can distinguish between someone who's depressed and someone who's struggling with diabetes distress is that the person living with diabetes distress is likely to have these negative feelings and thoughts really only focused on the diabetes. The rest of their life might be, going fairly well. Whereas with depression, it's much more global. The person is likely to have negative thoughts, not just about the diabetes, but about themselves, about other people, about the world, about the future. So they are distinctly different. And the reason it's really important for the health professionals on the line to take notice of diabetes distress is because it's actually distress, not depression, that is associated with a higher HbA1c. So there's a really important clinical reason why we pay a good deal of attention to diabetes distress. So if you've identified some of what I've shared tonight, you might be wondering, well, why me? Why am I more likely to, why am I struggling in this way? Well, I think there's two sides to this. I think there's a natural progression of diabetes, which can feel very unrelenting. So there's these magical HbA1c targets that, if we don't achieve them, there can be quite a natural sense of failure. Even though we haven't failed, we can perceive it as a failure. And of course, our appointments are medical in focus, and they do tend to focus on the outcomes rather than the behaviours. And of course, I'm pleased to say that this is changing. Health professionals that I work with are really very, very keen and open to broaden the focus beyond just the medical focus. But there's a time limit to what we can discuss in a time-limited appointment. So sometimes there isn't the space, or sometimes we don't have the confidence, or the health professional doesn't have the confidence to broaden the conversation out, to think about emotions. And this can be experienced as unrelenting. And of course, there is a worry about long-term complications, and this may be exacerbated by our professionals who may have in the past, used the threat of complications as an attempt to motivate us. And again, I don't think we need to make anyone wrong for this. I think, oftentimes fear of the future can be motivating up to a certain point, but, also that can play on our minds that, our behaviours in the here and now can impact us in the future. And I also wanted to say a few words about early experiences, because there's a lot of evidence now that actually experiences in our childhood impact our ability to care for our health in adulthood. And there's an international body of research called the Adverse Childhood Experiences studies that have been going on internationally for over 10 years now. And if you're interested, I really encourage you to Google adverse childhood experiences, and you'll see more about those studies. But they're showing really clearly that actually what happens to us as children does impact our growing brains, our growing emotional development, and this impacts our ability to take care of our health in adulthood. So you might be wondering, well, what's an adverse childhood experience? And of course, there's the things that we would expect to be on this list, things like abuse, physical, emotional, sexual abuse, seeing domestic violence at home, having a parent who's got a mental health difficulty or is using substances. These are really important early experiences that impact us, and they impact us because as children we need to feel safe in the world, and if our life experiences have demonstrated that we're not always safe, then that has an impact on our growing sense of self-esteem and our ability to trust in other people and in ourselves. And if this is you, I really want to encourage you. These experiences can be worked through, they absolutely can be healed in a therapeutic relationship, and you can move beyond these. But I wanted to raise this because it's, this is an important element of why we might be struggling in the here and now. So there's this kind of early experience that plays a part, and then there's just the natural difficulty and struggle of living with diabetes, which really can lead us to feel very, very defeated, and it can lead us to feel like quite hopeless at times. And I want to reassure you, because we are living in an exciting time in the diabetes community, because we have never been living in an age where there's been so much, understanding about the kind of medical approaches to diabetes, the educational, the self-management tools, the technologies. There's so much at our fingertips. But I think, when we think about certainly our National Health Service approach to diabetes, we haven't, as a culture, as a diabetes professional culture, really attended to the emotional demands of diabetes. And that, I'm really pleased to say, is changing, and it's changing fast, and I'm really excited by that. But I want to reassure you, because many people that I support actually really do need support at the emotional level, before they can engage with these other elements of this sphere. And so if you are struggling, if you feel that you struggle to really make the most of all of the self-care, technology, medication, if you struggle, it may well be because you really need this foundation of understanding and getting that emotional support for yourself in order that you can engage with these other areas. So with that said, then, how on earth do we start to manage diabetes distress? Well, again, I want to remind you, this is for information, and I'm going to share some ideas with you, but my intention is really to steer you towards getting personalised support for your diabetes distress. But I wanted to share some general strategies that we as psychologists use to help people with diabetes be able to cope better with the diabetes distress. And there are 4 areas of diabetes distress, and these are have been identified in what we call the diabetes distress screening scale, and you'll see the reference for that at the bottom of this slide, and that's a kind of self-assessment quiz or tool that you may well be asked to complete by a health professional if they are open to having the conversation about diabetes distress and signposting you for support. So the diabetes distress screening scale encourages us to think about the 4 areas of diabetes distress, and I'm going to go through each of these in turn. So the first area of and to say, you may well be struggling with each of these 4 areas, or you might be struggling with just 1 or 2. So it's very personal and it's very individual. But I'm going to go through each of these in turn. So firstly, you may well be distressed by the negative emotions caused by diabetes. And you'll see in that image, there's just a taste of some of the emotions that you might well be experiencing when it comes to your diabetes. And it's important to say that, all emotions are helpful. Emotions have evolved in us for good reason. They've evolved in us to give us data and information about what's going on for us internally. So yes, we all want to have lots of positive emotions in our life, but oftentimes it's the negative emotions that are really crucial to take notice of, because those are the ones that are telling us information about something in our life that's off, or they're a signal that we need to get some extra support for ourselves. So the goal of working with negative emotions is to learn skills to be able to manage your thoughts and feelings differently. And you may be familiar with a type of therapy called cognitive behavioural therapy, which is a mouthful. So it's often shortened to CBT. And CBT is an evidence-based therapy which is really designed to teach you how to take notice of your thoughts and feelings and how to change and adapt them to feel better about life and to feel better about your diabetes. And so my goal, when I'm supporting people to think about diabetes distress, is to support them to do that work of learning the skills of CBT with a psychologist. And we'll think towards the end of our time together about how to get that referral. But in the meantime, I encourage you, I've got here some ideas just to think about putting in place if you haven't already. Diabetes is distressing. We've talked about that. So I often begin my work with someone with diabetes by giving them a prescription to do something relaxing, enjoyable, positive each day in an attempt to start to balance out a lot of this negativity that diabetes naturally brings up in us, in order to get that balance, because we need a mixture of work, rest and play in life to feel good about life. So if life is all about work and demands and dealing with diabetes, it's natural that we'd feel burnt out. So, you know, I often say, give yourself a prescription at least once a day, perhaps 2 or 3 times a day, of things that you find relaxing, enjoyable, fun, and that lift your mood. And I've put here some ideas. These are just some ideas that I tend to use in my life, but it's a personal inquiry. You know, what do you find fun and what do you find joyful? And create a list. Create a list of at least 10 things, 20, 30, 50 things if you can, and put that list where you'll see it often. Put a reminder on your phone 3 times a day. When the reminder goes off, do something fun for yourself, even if it's just for 5 minutes. Give yourself these injections of positive emotions, and that builds you up. You know, it's a self-care prescription, and it builds you up to give you the energy and the capacity to do some of this harder work of inquiring into some of these negative emotions. And, you know, talking about CBT is really a webinar in and of itself, but I want to just share some questions with you to help get you thinking between now and perhaps get going and speaking to a professional and starting that journey of CBT. You know, what needs to happen for you to feel better? You know, if you think back in the past when you felt less distressed with diabetes, what was different? Were you doing more things that were fun? Were you less stressed? How can you recreate some of that you found helpful in the past in the here and now? You know, think about your week. Are there some days where it feels easier to manage? You know, what's different on those days? Is it that when you're with certain people, you feel more distressed? Is it when you've got a certain set of demands, you feel more distressed? Can you, in the short term, just make some changes to these other parts of your life to allow more space to deal with your diabetes? And I'll talk more about getting those all-important referrals in a moment. But I wanted to move on to this second area of diabetes distress, which is distress caused by the burden of diabetes management. And again, you know, a theme is developing. It is distressing having to do multiple self-care tasks every hour and every day. So reward yourself. You know, do a little deal with yourself. Give yourself encouragement every time you do an unwanted self-care task. You know, we often, as people with diabetes, talk really harshly to ourselves. And oftentimes, you know, the question, would I talk to my best friend the way I talk to myself? Would I criticize him or her? Or would I encourage her? Would I say, look, yeah, things aren't going great right now, but well done, you did X, Y, or Z, and that's a really important piece of the puzzle. You really took care of yourself there. You know, even just these small encouraging positive self-statements really, really help. And think about baby steps. You know, what's a baby step you could take to feel more in control? And absolutely, you know, do take up in the invitation for structured education. You know, the evidence shows that getting in a group of peers and being able to talk about what's really going on really helps elevate our feelings of distress. Of course, you know, a lot of that education is going online now, but think about peer support. And again, I've got some ideas about how you might do that for yourself in a moment. So the third area of diabetes distress is the relationship you have with your health professionals. And the health professionals on the line, take note of this. You know, sometimes we can unknowingly be contributing to the distress that someone is experiencing. And, you know, again, this isn't about any sort of blame, but absolutely it's about equipping ourselves with knowledge and experience to be able to have these conversations. And if you're a health professional listening, I really want to signpost you to a fantastic course called the Nuston Diabetes Counselling and Empowerment course. And if you go to diabetescounselling.co.uk, you can learn about how to get registered for that course. That course is for health professionals, and I've been really lucky to be a participant on that course. I was also really fortunate to be involved at one stage with some of the behind the scenes of that course. So it comes really, really highly recommended, diabetescounselling.co.uk. So that's for health professionals. Now, if you're someone living with diabetes listening to this and thinking, yes, I struggle in my relationship with my health professionals, please don't worry. You know, this again, these are strangers when we first meet them, and it takes time to trust our health professional enough to share what's really going on for us. So do what you can to find a way of opening up a little bit about what's going on for you. And I really struggled with this for years. I just didn't have the language to know how to broach the conversation. Certainly, the Language Matters NHS England piece of work that, again, you can Google, definitely brought out this message that people with diabetes say that often they feel that the health professional is talking at them rather than with them. And if that's your experience, you know, I encourage you to use, you know, one of these phrases that you see on this slide, or something that's more your style, to just start to broach this conversation. You know, I'm struggling with how I'm feeling. Can we talk about that today, as well as, you know, my HbA1c? Or my diabetes isn't well controlled right now, and I think that's because of how I'm feeling. Or I think I might be ignoring diabetes to help me cope with how I'm feeling. You know, use your own language, of course, use your own style, but do find a way of having that conversation, and absolutely choose a health professional that you find the easiest to talk to and open up with. And then the final area of diabetes distress is distress caused by relationships with family and family and friends. And Diabetes Burnout, the book by Bill Polonsky, which again I highly recommend, he talks about the diabetes police, and I think that's his loving way of talking about those family and friends who are just really worried about us. And so they show their worry perhaps by, you know, unintentionally nagging us or kind of scrutinizing us as if they're the police force in our lives. And his book really goes into depth about a lot of topics, but particularly about how to talk with our loved ones. And this is the model that he suggests. You know, share how you're feeling about your diabetes, invite the other person, the family member, to share how they're feeling, and simply listen and say something along the lines of, you know, I know you care about me and want to help me. So here are a few things that you can do to help me, and then list them out. And again, refer to his book for much more information on that. But there are ways of enlisting your family and friends with to be able to support you differently. And absolutely, again, you know, think about peers in your community. Certainly there's the community here tonight, and, you know, Diabetes UK, JRDF, many of the diabetes charities have peer support services, and of course you can find other people living with diabetes on social media using the hashtag DOC, Diabetes Online Community. So, you know, I've shared a few ideas there, but I really encourage you, you know, don't feel overwhelmed. The idea is that you seek one-on-one support from a professional who can guide you to do this work step by step. But if you want to have a takeaway for tonight, you know, just focus on one thing. And I list here a few of the one things that I've tried over the years, and now I try to practice most days. And I do say practice because I have bad days as much as the next person, but I do find these are really helpful self-care practices to keep things in perspective. So there's a lot of evidence that gratitude is a quality that helps us feel better about life with or without diabetes. I try and do a gratitude list with at least 10 things on it every day. If I'm really struggling, I'm grateful that I live in a country that has running water and I've got a roof over my head. So you can start as small as you like. Self-care, you know, I practice making sure I have time for enjoyment, time for me in my day. I practice saying no, and I practice saying wait. So what my diabetes needs come first. I forgive myself when I make apparent mistakes. I see things as a learning journey. And I forgive others when I feel that they perhaps have let me down. sometimes easier said than done. And I've made a deal with myself to practice only focusing on what I can control and influence, and letting go of things that I can't. And I do what I can to connect with others and practice being my own best friend. Speak to myself in the quietness of my mind in the way that I would speak to my best friend. So the hope is that one or two of you may feel ready to access psychological support for yourself, in which case I really want to encourage you to do that. Absolutely speak with the health professional that you feel most able to share your struggles with. That could be your GP, it could be your diabetes professional, but suggest that you'd like to see a talking therapist, a psychologist, about your diabetes, and can they refer you. And there are unfortunately still geographical differences in how available psychological support is for people with diabetes, but much of the psychological support has gone online, and so it's being done via video call, via online therapy. So absolutely, there are still referral pathways open for you. I've also got my contact details there. And beyond accessing psychological services, if there is a wait, I really want to encourage you to access community support. If you're struggling with a diabetes-specific eating disorder, do visit dwed.org.uk. You may want to explore BEAT, eating disorders, and the Big White Wall, the Samaritans. These are all community organisations that can support you to promote your mental health holistically. And these are some suggested resources. I've already flagged peer support, and Diabetes UK have a care line. There are some websites here that I definitely signpost people that I'm supporting to. And the Diabetes Burnout book and my book, Diabetes and Wellbeing, absolutely do explore self-help materials for yourself. So I think I am now at the end of our time together today. I really want to thank you for listening tonight, and I'm really ready to answer any questions that you have. I don't know, Claudine, if you're there.
So we've got loads and loads of questions coming in. Thank you so much, Jen. That was really informative, and there's lots of people sending in their thanks for tonight. So something that a lot of people have asked is the book that you've talked about. So I don't know if you can just give people the title of that again. I think it was just on the last slide, was it?
It was. So the title is Diabetes Burnout. And the subtitle is How to Recognise and Manage It. And it's the book on the left. And it's written by an American colleague called Bill Polonsky, and you can get that on Amazon. And I also will give a plug for my book, Diabetes and Wellbeing, which was written in my maiden name. So you can find that under Jen Nash on Amazon also, and absolutely those other resources. But yeah, really pleased to hear, Claudine, that people are interested in getting those self-help books, because they really do speak to the experiences we're thinking about tonight.
Now we'll hop straight into the questions. So a question that we've had quite a few of: do you have any quick tips to lift mood when you're struggling a little bit or having a bit of a bad day?
Yes. Firstly, I would really think about, if I was sat with my best friend right now and she or he was sharing that they were having a bad day, what would I say to him or her? Because I think it can be quite difficult to think about doing nice things or saying nice things to ourselves, but as soon as we bring a third person into it, it's really quite easy. Generally, if a friend's having a bad day, we say, I'm really sorry to hear that. Diabetes is a struggle. You've got a right to feel upset or angry or peed off or whatever it is, and speak that out to yourself if need be. Definitely speak it out in the quiet of your mind, but go and look in the mirror and say, I'm struggling right now, and it's okay to struggle. You know, what can I do to feel a bit better right now? And as I said earlier, create a list of at least 10 things, aim for 50 things that you can do that lift your mood. So, you know, I shared some of my ideas, you know, watching a funny clip of my favourite comedian on YouTube for 5 minutes, you know, phoning my friend who always makes me laugh, you know, stroking a pet, taking a 5-minute walk outside and breathing some fresh air, you know, going on social media and connecting with someone who makes me feel good. You know, have that list, and literally, you know, when you're aware that you're feeling low or feeling down, give yourself that gift of doing those things for yourself. And if it's happening often, absolutely take notice of that. That means that you have reached the limits of what you can cope with on your own, and that's okay. You know, none of us are designed to do life on our own. Absolutely make an appointment with your health professional and seek a referral for some support for yourself.
Thank you. So we've had quite a few interesting questions, actually. So I'm going to try and summarise them into one big question instead of obviously asking all of them. So we've got quite a few people on the line who are carers of people who've got type 1 diabetes, and they also seem to suffer with this, with burnout, and they're sometimes overlooked. Is there any recommendations that you've got where they could seek any help and support for their feelings that are obviously not directly to do with them?
Yes. Oh, I'm really pleased to think about the all-important carers who are doing such a fantastic job supporting people living with diabetes, and it can be a really lonely journey. So I do encourage you to seek out other carers, parents, family members, friends, partners, spouses, you know, who are also like you, supporting people living with diabetes. So you're not doing this alone. So you've got a sounding board. You know, it's a cliche, but a problem shared often is a problem halved, and sharing and releasing a lot of your worries and your distress with someone who gets it and who is also walking that journey, it really helps, because, you know, when you're feeling strong, you can help them. When they're feeling, you know, down, you know, vice versa, you can be on that journey together. And absolutely, you know, the resources that I shared earlier, there will absolutely be Diabetes UK, JRDF, all of the organisations, they will absolutely have more resources to support you as someone supporting people living with diabetes. So, and absolutely, you know, do what you can to get that talking therapy space for yourself if you need to. You know, I think as we're in a place where thankfully the stigma attached to getting psychological support is lifting. You know, we all have mental health, we all are on that continuum of mental well-being. You know, there's absolutely no shame in seeking out support for yourself. Explore Mind, explore mental health charities, the Big White Wall, you know, Samaritans, all of these organisations, you can absolutely gain a counselling space and relationship to help you through, so you can be stronger for your loved one. But I'm really pleased that you're here.
Okay, moving on to something else, slightly different topic, but around the differences. So I think we've had a lot of questions saying, how am I just lazy, or is this diabetes burnout, or is the fact that I'm frustrated all the time or tired all the time, is that attributed to diabetes burnout? How can people, are there any kind of key markers that people could spot to help identify that they should ask for help?
Yeah, well, there are some self-assessment tools
that
you
mentioned
can
that,
use.
Didn't you, earlier?
Yeah, I mean, you know, I prefer people to seek support from their health professional, but you know, these are available online. You can Google on the diabetes distress screening tool, or another one is called the Problem Areas in Diabetes Scale. If you Google these, you will find these self-assessment measures, and you can do that, and you can, you know, score it and see, are you simply, in inverted commas, feeling a bit lazy and a bit worn out, which we all do, that's part and parcel of managing diabetes. Some days we all have our lazy days, we all have our days where we're just not giving it our all, and I think that's okay. We need to be kind to ourselves, but I think it's when it goes on for more than a couple of weeks at a time, and when it's impacting our ability to care for ourselves in the way that we know we could if we got support. So I think I recognise that kind of narrative of I'm just lazy, but I think there's sometimes that sense of laziness is actually really a sense of hopelessness and defeat, and that is absolutely, that will come out on these screening tools, and your score for diabetes distress, and that's absolutely a sign. And the laziness continues. We're all human, we're all on that continuum of feeling lazy at times, and that's okay, but that shouldn't be a barrier to you getting the support that you need.
Great. And again, I'm sorry, we're just going a little bit over because I'm conscious that we started a little bit late and keen to get some of your questions answered. So we've also had quite a few questions on people who have almost pretended to forget that they've got diabetes for, a day or a week to try and normalize, I guess, their lives. Is that something that you've got any tips for, or also have you done, I guess, in your...
Well, I think this is, again, very natural. It's an attempt to take care of yourself. So in that regard, it's from a really important part of you that recognizes you've reached your limits and wants to be kind to yourself. My advice, my encouragement is to speak to your health professional about this desire to have a day off, and think about whether or not there's ways that you can do this whilst also keeping yourself safe. Now, the Diabetes Burnout book talks about having a diabetes holiday, and this is exactly that. It's having a day where you let up on the demands of living with diabetes, whilst also ensuring that you're doing the minimum that you need to stay healthy. So it's kind of a both and the really important message here is to do this in collaboration with your health professional. But you can absolutely read more about that in the book Diabetes Burnout, and that could actually be a really neat conversation starter to take that with you to your health professional and say, look, I've been reading about this. I want to pretend to forget my diabetes for a day, but equally I want to keep myself safe. Can we think about what that might look like? So it might be, what's the minimum level of self-care that you need to give yourself on that day in order to make sure that you're safe, and that's for your health professional to help you and guide you with. But yeah, absolutely, I definitely have days, speaking personally, I definitely have days where I am kind to myself and do those minimum tasks and be okay and be come to a peace at thinking, well, my diabetes isn't going to be exactly in range right now, but that's okay. I'm doing the minimum that I need to stay healthy for today. So yes, there are ways of doing this safely under the guidance of your health professional. So really encourage you to have that conversation.
And then another thing that, as I say, we're getting loads of questions on different things, but one is about technology. So how do you think the advances in technology within diabetes, so pumps and obviously the Freestyle Libre system, how these have helped people maybe make alterations to their life that helps with diabetes burnout? Do you think it helps or hinders?
Yeah, well, absolutely. The more choice that we have available as people living with diabetes, the better. The more options that we have, the more of a sense of control we have, the more likely we are to feel engaged with the diabetes rather than kind of defeated by it. But I think it is a very personal matter. I personally am very low tech when it comes to my diabetes, and I'm happy with that. And that's what suits me. But absolutely, I work with many people who have really, they've been revolutionized by advances in technology, the pumps, Libra, all of the technology that we have available to us. So it absolutely is a personal journey of relating to diabetes and finding the recipe that works for you. And certainly there are a small but significant group of individuals who struggle with technology, and actually, having a lot of data to hand can raise their anxiety, and that's really important too. So it is often about trying things out and experimenting and doing more of what works and less of what doesn't. And that's what's really wonderful about the place that we are in right now in the diabetes world, that we do have many more choices and options.
And then just to finish on, the last question, I guess, is around the stigma associated with asking for help for this kind of topic. So we've had a lot of people who've said that they find it difficult to talk to their nurse, they find it difficult to talk to their consultant, and they feel like failures if they want, if they mention anything around this. I know you touched on it in the presentation, but just to finish off on it.
Absolutely. No, and I'm really pleased to speak more about it, because it's so important. And I think there has been this, certainly, the generation that we've been living in, and that we've kind of passed through, there absolutely was this kind of stigma about mental health, about admitting that we need help. Does that mean I'm mad? Does that mean I'm crazy? All of these narratives, which, thankfully, there's been a real explosion in, really normalizing mental health beyond diabetes. There's been so much that the Royals have done around promoting mental health. There's been so much in the media about, just having conversations about our mental health and putting it on a parity and on a level with physical health. I think that we still encounter people on that continuum. Some people, some professionals we meet are really comfortable and really want to have those conversations about mental health or emotional well-being, and others shy away from it. So I really encourage you, if there's no one right now in your team that you feel comfortable having this conversation with, I encourage you to ask to see a different professional, and that might feel difficult to do, but it's not uncommon, in services, to ask to be referred to a different nurse or a different doctor or a different dietitian. It doesn't necessarily have to be the nurse or the doctor. It could be your dietitian, it could be your GP, just someone who you can start to have that conversation with, who kind of gets it. And just saying, I need help to think about the emotional impact of my diabetes, just having those words come out of your mouth, you've done the hard work. And so I really encourage you to take that brave first step and speak that out. And if you're not happy with the response that you get, absolutely, ask to have a second opinion, ask to, speak to another member of the team, and bring in the book. If you've got one of those books, bring it in and say that you've been reading it and that you feel that you relate to it. Use that as a kind of conversation tool. And if you're a professional listening to this is really important information that we're hearing tonight, that absolutely some of us, some of our people in our that we're supporting struggle to have these open conversations. So if you're listening tonight, do what you can to ask about the emotional impact of diabetes, and encourage your colleagues who are not here tonight to do that just as importantly.
Thank you so much, Jen, for that really informative session. I hope everyone feels that they've gained a little bit of insight and a bit of courage, I guess, from you about how they can approach their healthcare team and to get the help that they need or want. Tonight's session will be available on demand. We will send you an email in the next few days with the session on, so you can listen back to it. The slides unfortunately won't be available separately, but as I say, it will be available on demand. I'd just like to thank Jen and thank you all for listening tonight. And again, apologise for the technical issues we had at the beginning of tonight's webinar. The questionnaire will come out to you, so I really hope that you complete that, and have a good rest of your evening. Thanks again, Jen.
Thank you. Thanks, everyone.